The image of my sister-in-law hemorrhaging and almost dying while delivering my youngest niece will forever be engraved in my brain. With that being said, the United States has one of the highest maternal mortality rates compared to any other country. If you didn't know that, let's talk about it. In a TED Talk speech, Elizabeth Howell describes her experience as she witnesses a mother pass away after delivering a healthy baby boy. What was supposed to be one of the happiest moments for the father was now one of the saddest. She goes on to say that as much as she wishes this was an isolated incident, that is unfortunately not the case, as every year the United States has between 700 and 900 pregnancy-related deaths. According to an article from everymothercounts.org, on average, Black women are 12 times as likely to die from pregnancy-related complications than white women. The article also states the United States has higher rates of maternal deaths than 45 other countries, and is the only developed country with a consistently rising mortality rate. Additionally, a report from the CDC stated that in 2020, 861 women were identified as having died of maternal causes, compared with 754 in 2019. The mortality rate for 2020 was 23.8 deaths per 100,000 live births, compared with a rate of 20.1 in 2019. For non-Hispanic Black women, that was 55.3 deaths per 100,000 live births, 2.9 times the rate for non-Hispanic white women. Howell explains that 60% of these deaths and complications are preventable, and that there are concrete steps and standard procedures that can be implemented in order to prevent these outcomes from occurring, thus saving women's lives. For example, if a pregnant woman was in labor and had high blood pressure, the doctor would treat her with the appropriate antihypertensive medication in order to prevent a stroke. Or if a doctor tracked blood loss during delivery, they could detect a hemorrhage sooner, saving both of these women's lives. Howell explains that the American College of Obstetricians and Gynecologists have banded together to implement standard care practices in hospitals throughout the country. She explains the AIM program, or the Alliance for Innovation in Maternal Health Care, where the goal is to lower mortality and severe morbidity rates through quality and safety initiatives across the country. She explains that the AIM program currently has the potential to reach over 50% of U.S. births. If we continue to push for the standard of high quality care across the country, and that every woman in every community receive the same high quality treatment, and facilities utilize standard care practices, the maternal mortality rate and severe morbidity rates would start to diminish. The United States has decades of unacceptably high rates of maternal death and life-threatening complications during delivery, resulting in decades worth of devastating consequences for the mothers, the babies, and the families. The question is, are we as a society ready to value pregnant women for every community and strive for high quality maternal health care?